we'll go ahead and start. Today we're going to start talking about cardiac radiology, which hopefully you'll find somewhat interesting. First thing that we have to do real quickly, and this stuff here I'm not going to be testing anybody on, but we need to review some basic cardiac anatomy and physiology. So if you remember, there's different pressures inside the heart, different chambers and the great vessels surrounding the heart, and different portions of the heart will have different oxygenation levels of the blood. But what I think you need to remember is anything on the right side of the heart, and that includes the cauda vena cava coming into the heart, the pressures are low. In any part of the left side of the heart, which basically is the left ventricle, the pressures are going to be much higher. Same way with the oxygen saturation. So deoxygenated blood, for the most part, fills the right side of the heart. Of course, then the right side of the heart returns that blood to the lungs, where it becomes oxygenated and returns to the left side of the heart. So anything in the left side of the heart has a much higher oxygen saturation level. We also have heart sounds that y'all listen to with the stethoscope. I describe them as lub and dub, which I think is pretty fitting, but physiologists have described them more exactly as heart sounds 1, 2, 3, and 4. Again, I'm not going to hold anybody responsible for exactly what happens during the heart sounds, but I think you should, for the most part, know that the heart sounds are due to valve openings and closures in a normal animal, and sometimes due to abnormal and turbulent blood flow in abnormal animals. The ECG, again, measures and evaluates the electrical components of the heart. I don't know if you have had a cardiology class yet, but you're going to learn about the different waves of the ECG and the P wave and the QRS complex and the T wave and the intervals between them and stuff like that. And when they become big and elongated and tall and fat and short and skinny, what those may or may not mean. Again, the ECG measures the electrical activity inside the heart, and sometimes it will give a hint on what may be happening mechanically, but for the most part, the ECG is strictly limited to the electrical part, and mechanical is completely separate, although driven by the electrical part. Also remember that there are coronary arteries. The coronary arteries are the arteries that are actually in and on top of the myocardium, which is the muscle of the heart itself. And these coronary arteries, their function is to supply oxygenated blood to the heart muscle and keep the heart muscle alive. Luckily, in animals, at least that we recognize, we don't have anywhere near the kind of coronary artery disease that people do. Coronary artery disease is when you get an occlusion or a plaque that causes an ischemic event in a coronary artery in a human. That's called a heart attack. And we don't really have, at least that anybody recognize, a classic similar heart attack in animals. We just don't have to deal much with coronary artery disease in animals. Why that is, I'm not really sure. So this is an example here of a contrast enhanced angiogram. This is before echocardiogram. This is how people would do a lot of the cardiac evaluation other than just plain film radiographs. And so this is a catheter, it's invasive. You have to put the catheter down the jugular vein or down a carotid artery or femoral vein and advance it into the portion of the heart you want to study. And then you would inject contrast material into that portion or that chamber of the heart, and would allow you to make it more opaque or show up white. And in this particular case, the catheter was stuck into the sinus of Valsalva, which is the root of the aorta. Contrast was placed in that, and you can see coming out from the edges of this, you can see there's these little coronary arteries, and these are the coronary arteries that supply the heart. They're on the outside of the heart, and they supply the heart muscle, and they arise from the root of the aorta or the sinus of Valsalva. Cardiac veins, again, no one's going to worry about them. This is the blood that comes out of the heart muscle itself and returns back to systemic circulation. So this takes the deoxygenated blood back from the heart and puts it back in systemic circulation so it can be reused essentially. When we look at the heart, and this is where it starts to get important radiographically, is when we see the heart region on radiographs, we are looking at the heart, but we're not just looking at the heart. We look at what's called the cardiac silhouette. And the cardiac silhouette in an animal is located in the middle mediastinal space of the thorax. There's also a cranial mediastinal space, and there's a caudal mediastinal space, which we'll talk about in the next section. We talk about pulmonary radiology. But for this right now, just suffice it to say the heart is in the middle mediastinal space. And inside of the cardiac silhouette that we see on radiographs, it contains the heart, of course, but it also contains the pericardial sac, which is a kind of a non-stretchy, fibrous, thin membrane that surrounds the heart. Between the pericardial sac and the heart itself, there is a small amount of pericardial fluid. And in a normal animal, it should be just a few drops of pericardial fluid that should be in the pericardial space. And the function of that fluid is just to let the heart beat and keep things from moving and getting friction and things like that. It keeps things from rubbing together and stuff like that. So it adds a little bit of lubrication between the pericardial sac and the heart itself. We also have inside the cardiac silhouette are the coronary arteries. You will never see them on radiographs, but obviously they're there. And then you also have the origin of the great vessels. So again, the sinus of Valsalva, which is the origin of the aortic root, where the aorta comes out of the left ventricular outflow tract, that is inside the pericardial sac, and so is the origin and termination of the caudal and cranial vena cava. This stuff here is important, and you probably should know these clock face analogies. So if you have a lateral view of a dog's chest, you have to know this clock face analogy, and this kind of tells you what particular chamber lives where. So if you imagine the oval shaped or the round heart as a clock, at the top is the 12 o'clock position, and typically between about the 12 o'clock position and 1 or 1:30 is where the left atrium lives. Okay, so right up in this area, right in here is where the left atrium lives. From about the 2 o'clock position all the way down here to probably 6 o'clock. All of this area right in here is where the left ventricle lives. Then from about 6 o'clock over to about 9 or even maybe 9:30 or 10, all of this area over here, I simplified this area and I just call it the right heart. Okay, down lower ventrally down in this area is most of the right ventricle, and up here is mostly the right atrium. Okay, but we can simplify it for radiographic purposes that the right heart will suffice instead of just saying separately right atrial region and right ventricular region. And then from about 9:30 or 10 up until about 12 again, this is where the aorta comes out. So the aorta is the great vessel, of course, and it comes out here and it kind of winds around here and then it goes down the dorsal aspect of the thorax. So again, the lateral view of what lives where with the clock face analogy, you need to know that. Here's the same thing, but on the VD view, what you also need to know. And the cool thing about this is that all of the stuff that we're going to learn for the next few days on radiographs and anatomy and pathophysiology and what you see radiographically, this is unfortunately unlike a lot of the stuff that you learn in vet school. This stuff is clinically applicable and you're going to use this probably every day for the rest of your career. Okay? So on the VD view, if I look again, start at the top of the clock, so around noon, if I go from about 11 over here to about 1 is where the aortic arch lives, and that's AA. So the aorta comes out here and it has an ascending portion and it has a aortic arch and the descending aorta, which comes down this way. So up in the top, very top of the heart is the aortic arch. Then very specifically around 1 o'clock on the VD view is where the main pulmonary artery segment lives. Okay, so that's the main pulmonary artery segment before it branches to feed the individual lung lobes. So the MPA, you'll see that abbreviated, lives right at the 1 o'clock position. From about 1 down to about 2 or 3 o'clock, down in here, you can see left atrium. And that's a little bit confusing because in this particular case, LA stands for left auricle, not atrium. And if you remember from anatomy, the auricle it's kind of like an appendix of the atrium. So it's a little blind pouch of thin muscle that kind of is this little extension off the atrium. And that's called the left auricle. And the left auricle in a dog lives over here around 1:30 to about 2 or 3 o'clock, right over here. And you will hardly ever see it. From about 3 o'clock over again to about 6 or 7 o'clock, just like on the lateral view, is where the left ventricle lives. Then from about 6 or 7 o'clock all the way over here to you get back over to the 11 o'clock range again is the quote right heart. So that's where the right ventricle lives down in this way and the right atrium up here. Okay, so there's the two examples of the lateral view and the VD view and what chambers live where, and you have to know that. And there's no easy way to do it except memorize it, okay? There are some similarities. If you notice on the lateral view and the left ventricle and the VD view, the left ventricle and the right heart is all the same. It's in the same part of the heart, same part of the clock face analogy, okay? What varies is the rest of it. So you can consider this the same on both and then just learn what happens up in this area because it's different on the lateral view versus on the VD view. Okay, perfect. Now, would be really cool. This is a lateral view of a dog and everything's labeled. Wouldn't it be cool if radiographs came that way? Every time you shot a radiograph of a dog, everything was labeled. The anatomy was labeled for you. That would be awesome. Doesn't happen, at least maybe someday it will, but right now it doesn't, okay? So if you remember the clock face analogy, just as a review, up in here between about 11 and noon or 1 o'clock is the aortic arch. Here comes the aorta right in here, and it comes and spins around and goes down this way in where the dorsal aspect of the thorax. So from here to about here is the aortic arch. At 1 o'clock, up in here, we said lives the left atrium on the lateral view. So left atrium, here's a little left auricle, but the left atrium lives at the 1 o'clock position on the lateral view. From about 2 o'clock down to maybe 6 or 7 o'clock is the left ventricle. And over here is the right heart. So here's the right ventricle from about 6 or 7 over to about 10 o'clock or 11 o'clock. So right ventricle, and here's the right atrium region right in here. On the VD view, let's review the clock face with labeled hearts. Okay, so on the VD view, from about 11 o'clock over to 1 o'clock, again, is the aortic arch. And we have an ascending portion of the aorta. We have the aortic arch itself, and then we have the descending portion of the aorta. So the aortic arch lives from about 11 over to 1. Right at the 1 o'clock position of the heart on the VD view lives the main pulmonary artery segment. So PA, pulmonary artery, that's the MPA, the main pulmonary artery segment lives right at the 1 o'clock position. Then we said on the VD view, we have this little weird left auricle that lives from about 2 to 3 o'clock. And again, the left auricle, you'll hardly ever see. On rare cases, which we're going to talk about, you will see it. Then from about 3 o'clock down to 6 or 7 o'clock is the left ventricle. And then from that 6 or 7 o'clock all the way back up to about 11 o'clock is the right heart. So right atrium at the top and right ventricle at the bottom. Okay, those are good examples, good labeled examples. And again, you need to know what lives where. Now, the real key, and one of the things that you should start asking yourself is one of the big chambers that we see that's an important chamber that we see on the lateral view, right up in here, the left atrium. Notice that we don't see it on the VD view. It's not labeled. Where's the left atrium? Right here. It's not labeled. We saw the left auricle between about 2 and 3 o'clock, but I don't see where the left atrium is labeled. So in a normal dog and a normal cat, the left atrium on the VD view is smack dab right in the middle. And in a normal animal, you won't see it because you don't see it in tangent. It's right in the middle of the heart. It lives right here. Okay. We'll review that in a minute when we start talking about disease processes and discrete chamber enlargements. So why is it important to know this clock face analogy and what lives where? Well, depending on what cardiac condition the animal has, whether it's a congenital condition or an acquired condition, different chambers of the heart and the aortic arch and maybe the main pulmonary artery segment may become enlarged and they get too big and they get bulgy and they will deform that portion of the heart. And so we need to know what lives where, because anatomically we know if this part up in here on a BD view starts to become enlarged, that's where the main pulmonary artery segment lives. And there's certain diseases that will cause discrete enlargement of the main pulmonary artery segment. That helps us to make a diagnosis. These are old slides. And again, these are from contrast enhanced studies. So I wouldn't spend a whole lot of time looking at these, but this just shows the right side of the heart. A catheter was placed into the right ventricle. Here's the right ventricle, and you can see out in here going out into the pulmonary outflow tract, the right side of the heart on the lateral view, and it branches and gives rise and arborizes into all of these peripherally located pulmonary arteries. Here's the same thing, but now we catheterize the left side of the heart. So here's the left atrium around the 1 o'clock position. This is the valves between the left atrium and the left ventricle. Of course, that's the mitral valves that live right in there. This is the left ventricle, so that's the lumen inside the left ventricle. And then here's the aortic arch coming around right in here. Cat lateral views look the same. The anatomy is essentially the same as on a dog one. So here's the left atrium, left ventricle, right side of the heart, aortic arch coming around on the lateral view. Cat BD view, again, it's essentially the same. Here's contrast enhancement of the cat. It's the same as what was in the dog. And here's the same thing in a cat. Again, essentially the same thing as a dog. So now that you know some of the anatomy of the heart and what lives where and what chambers live where, let's look at some radiographs of animals. So here's a lateral view of the dog's chest. And just to get you oriented, that again, we reviewed yesterday, there's 5 basic opacities you can see in a radiograph. And if you remember, those opacities from most opaque or most white to least opaque include metal. Okay, do you see anything metal in this radiograph? Well, I do. I see this thing right in here. Okay, what is that?
The microchip?
Yeah, that's a microchip. That's an ID transponder that you injected into the dog's skin. So that's a little metal portion there, and it's bright white. Okay, so the next opacity that's not quite as bright white or opaque as metal is going to be mineral or bone, which is the same thing. And so you can see where's some bone. Well, here's the front legs, there's the humerus, there's the cortex. It's pretty white, okay, because that's nice, strong bone. Here's bone in the vertebral column. There's the dorsal spinous processes and ribs, sternum, and stuff like that. So those are examples of a mineral or bony opacity. So the next in order, the next opacity that you see is going to be soft tissue. Okay, so here's the heart. This right in here is the cardiac silhouette, which we talked about, and we know inside of the cardiac silhouette is the heart plus all those other things we mentioned. Okay, so that's soft tissue. Okay, what is this that lives right in here? Right, caudal to the level of the diaphragm is the liver. Well, notice this liver is much more opaque than the heart. Okay, they're both soft tissue, so ideally they should be exactly the same, but they're not. And that's because this portion of the liver is much thicker than that part of the heart. And so all of that adds up, and the terminology is it summates, and that portion of the liver is more opaque than this, even though they're both soft tissue. Okay, what's the next least opacity that you're going to see down the chart? So a little bit more darker than soft tissue is going to be fat. Okay, so where do I see fat? Well, I see some fat right in here. There's a lot of fat right in here in the mediastinal space. Okay, there's a little bit of fat reflections right down in here. So that would be fat. Okay, the next part that, and here's some falciform fat that I see underneath the liver over here. The darkest of the opacities is going to be air. So where do I see air? Well, most of the lung is air. Okay, and I see air around the dog. So those are our 5 basic opacities. So the other thing to keep in mind is when we hang radiographs, and it's called a hanging protocol, as people will call it, when we look at a lateral view of the dog's chest, abdomen, skull, stifle joint, pelvis, any body structure. If it's in a lateral projection, no matter what, we always hang it to where the dog's head is to the left. So cranial's to the left and caudal is to the right. It doesn't matter if this is a left lateral view of the chest, a right lateral view, you always hang it the same way. Cranial to the left and head to the right, or cranial to the left and tail to the right, caudal to the right. Okay, so just to get you oriented, here's the cardiac silhouette. Here's the trachea, this black thing, and it makes sense that it's black because what's inside the trachea normally? Air. Okay. We can see going out in here, we can see these branches of these little soft tissue things, and they're going out. These are the pulmonary vessels, which we'll talk about in our next series. So we have pulmonary arteries and veins, and they branch out into the lung. All of the air-filled structure around here is lung. Okay. Then I have the diaphragm in here, and behind the diaphragm, I have liver. And behind it, I have this gas-filled structure, which is the stomach, which has some gas in it. And then we have the thoracic vertebrae here. We have the ribs, we have the sternum, front limbs, and that kind of stuff. Okay, here's another dog. Same thing, left lateral view. So if I notice on the last one we just looked at, if I look at the diaphragm here, here's the two crura of the diaphragm, and they look like they're parallel to each other. Okay. On the left lateral view, the two crura of the diaphragm kind of converge in the mid portion. And that's one clue that you can look for radiographically to tell the difference between a right lateral view and a left lateral view. For the most part, the rest of the thorax, the heart and the lungs look pretty much identical on a left lateral view and a right lateral view when I go back and forth. Okay. Here's a VD view of the thorax. So VD stands for ventral dorsal. And again, when you hang up a VD view of the skull, thorax, cranial caudal view of the pelvis or the stifle joint or whatever, we always hang them the same way. So with VD views, the head's at the top of the screen, the tail is at the bottom of the screen, and it's like a mirror image. It's like you looking at yourself in the mirror. This is the right side of the dog, and this is the left side of the dog. Okay, that's how we look at VD or DV views. So if I look at this chest on the VD view, I see here's the heart in the middle. And so the base of the heart is up here. The apex kind of tapers and it goes usually off to the left of midline a little bit. Okay. Around the heart, I have all the lungs. I can see some of these pulmonary vessels going out into the lungs, and I see the bony thorax with a bunch of ribs in here. I don't see the spine as well. These are spinous processes that we saw really well on the lateral view, but now they're all kind of superimposed on top of each other and superimposed over the heart. So it's really busy and you really don't see them as well. Okay, so that's the VD view. So again, if you look, it kind of looks bulgy right here on this dog at the 1 o'clock position on the VD view. And then you should know, you think, well, what lives there on the VD view at the 1 o'clock position? And what lives there is the main pulmonary artery segment. So this dog might have mild enlargement of his main pulmonary artery. And there's diseases that will cause that. Then we have to, one of the fun things about being a veterinarian is we don't have to treat people. People are nasty for the most part. And so we get to treat, animals, which I think are in lots of ways much better than most people. But one of the hard parts about veterinary medicine that they don't have to deal with if you were an MD or a physician, or my parents used to say an RD, which stands for real doctor. I still get that to this day from my parents, believe it or not, is why didn't, all that schooling, why didn't you just become a real doctor? So anyway, but we have to deal with breed variations and different species. The human guys treat one species and two sexes, and that's it. We treat every other species in both sexes. So with what we deal with, especially if we're talking about dogs and cats, even within all of the canines and, dogdom, if you will, there's breed variations. And all these dogs are different sizes and they're shaped differently too. And so when we look at their radiographs, portions of their radiographs are also shaped differently. And we have to realize that that's not pathologic. It's just differences in the way the dog's made. And so there's certain deep-chested breeds that their thorax and their heart are going to be positioned differently and look differently than if you have a brachycephalic breed. So the deep-chested dogs, and give me examples of deep-chested dogs, would be like a Doberman or a Great Dane or a miniature Pinscher, which is a miniature Doberman. things like that, or deep-chested dogs. Whippets is another one. On the lateral view, their hearts are going to tend to be more skinny from right to left, and they're kind of tall. And on the VD view, they look a little bit more rounded in appearance, which we'll show an example of. The brachycephalic dogs, which kind of dogs are those? Well, those are your, your Dachshunds and your Lhasa Apsos and your Pekingese and your Boston Terriers and things like that. So those dogs on their heart lateral view and the VD view, their heart usually looks kind of big overall and kind of rounded. Okay, and that's just because they're a Boston Terrier, and their heart looks different than if he was a Great Dane. Okay. Also, we have to worry about that there a lot of times are age-related changes that can happen in the lungs and in the heart. And this is especially prominent in cats. In cats, as they get older, their aortic arch tends to elongate, and it becomes really prominent on radiographs. And the heart tends to, what people will describe, it tends to lie down on the sternum. So it becomes more parallel with the sternum than it is if it is a younger cat. Okay. So, and I'll show you some examples of this. So here's an older cat, and there's his heart. You can see the cardiac silhouette. You can see the lungs. Everything's really pretty. But if you look, in a normal cat, a younger cat, the heart would be more at an angle like this. In this particular case, it is kind of fallen down and lies more parallel with the sternum than in a younger cat. We also have, here's the aortic arch coming around, kind of get this prominence of the aortic arch. And on the VD view, sometimes you'll see that over here as a little soft tissue opaque structure over here, way up here in the mediastinal area. And that's called an aortic knob. Okay, that's a very typical, very common finding in an old cat. It's not pathologic. There's a lot of vets that will confuse that for a pulmonary nodule or a mediastinal mass. Now, I've had some vets say, maybe we're getting ready to put a needle in it and try to stick it. You probably wouldn't want to do that, being as it's the aortic arch. And so you have to realize that in an old cat, the heart tends to lie down on the sternum. It becomes more horizontal, and the aortic arch becomes very prominent. And you can see it right in here. If that was a true pulmonary nodule or a mediastinal mass that I can see up in here, I should be able to see it here on the other view as well, and I don't. Okay, technical artifacts. Positioning with all of radiographs is extremely important. Okay, positioning is key. And so, you have to have the VD views that are straightly positioned and the lateral views that are straightly positioned, especially when you're looking at the heart, because all of these things we just talked about, the discrete chamber enlargements, a lot of them you can't really read correctly if the films are crooked. So you got to make sure the films are straightly positioned and properly exposed. So how do you know if it's straightly positioned? Well, if I'm looking at the lateral views, I want to look up at the top of the ribs and the rib heads. And the right side of the rib heads should be superimposed over the left side of the rib heads. They should be right on top of each other and not splayed apart. We'll look at some of those coming up, and I'll show you examples of some that are better positioned than others. Okay. On the VD view, a minute ago, I showed you on the VD view that you can see the dorsal spinous process is kind of superimposed over where the vertebral bodies are. And they should be right down the middle. They shouldn't be off to one side or the other side. So you should be able to see those vertebral bodies and the dorsal spinous process is superimposed right down the middle, and the sternum also. The sternum shouldn't be off to one side or the other. It should be right down the middle of the dog. Okay. If the lateral view and the VD view are straight, then you can hang your hat on these discrete chamber enlargements of the heart. In general, how big should the heart be in the chest? Well, in general, the heart height on the lateral view should take up about 2/3 of the height of the thoracic cavity. The heart on the lateral view, width-wise, should be about 2.5 to 3.5 intercostal spaces in width on the lateral view. On the VD view, if you have a nice straightly positioned VD view of the thorax, there should be about the same amount of lung on the right side of the heart as there is on the left side of the heart. Okay, what are some doctorly terms, some medical terms that we need to worry about? The word for a small heart is called microcardia. And what do you see on the lateral view? Basically, it's pretty subjective. On the lateral view of the VD view, the heart just looks small. Sometimes the apex of the heart will become more pointy. And again, on the lateral view, we said the normal heart should be about 2.5 to 3.5 intercostal spaces in width. And this heart in this particular case, if it's small, will be less than 2.5 intercostal spaces in width. On the VD view, again, there's increased lung opacity between the heart and the lateral thoracic wall on both sides. So the heart overall, compared to the size of the chest, looks small. So here's an example on the lateral view. This heart here, it looks pretty small. There's a lot of lung around it. We said it should be 2.5 to 3.5 intercostal spaces. This one here's one rib to here. That's one intercostal space. Here's 2 intercostal spaces. This one's 2 intercostal spaces wide, which is kind of small, okay? And it's nicely positioned. So a small sized heart. On the VD view, again, look at all this distance between the heart and the thoracic wall on both sides. It's about the same amount, but overall, the heart size looks small compared to the size of the chest, okay? So what are things that can cause microcardia or a small sized heart in a dog? Well, a few things, or cat, I should say. Hypovolemic shock. So if you had recent trauma, okay, you can get a small sized heart. Addison's disease can also cause this. It's not common, but it can cause this. If you have an emaciated animal, it can also cause the heart to become small. Some underlying cardiac diseases, cardiomyopathies can also do that. A real common one that you'll see that'll go again with hypovolemic shock. If you have a ruptured mass in the abdomen, and let's say you had a splenic mass that ruptured, and now we have a bunch of hemorrhage in the abdomen and the peritoneal space, that will lead to hypovolemic shock and a small sized heart. Okay, so there's different things that will cause the heart to become small in appearance. Okay, before we venture off into specific diseases, then I want to talk about different enlargements of the discrete chambers and what to look for and show you some examples. So the first one that you're going to see, and this is super common, is left atrial enlargement. So again, you have to think, okay, so if the left atrium becomes big, number one, where does it live? And so we said on the lateral view, the left atrium lives at the 1 o'clock position. And so at the 1 o'clock position, we start to see a bulge of soft tissue at the 1 o'clock position. And we know right above the left atrium on the lateral view is where the mainstem bronchus lives of the trachea. And so as that left atrium becomes big, it starts to push up the mainstem bronchus dorsally, okay? And the caudal margin of the heart becomes a little bit more flat or straightened in appearance. And I'll show you an example of this in a minute. On the VD view, where does the left atrium live? And again, that's the tricky one that is not labeled because the VD view shows the left atrium to be right in the middle of the heart. It's right smack dab in the middle of the heart. And if you have a normal left atrium, you won't see it because of where it lives on a VD view. But if it becomes too big, it starts to have increased opacity in that area, just like that lateral view of the liver had increased opacity because now it's thicker. There's more stuff there. There's more opacity there, and it becomes increased in the way it looks. So here is super mild left atrial enlargement. This is where the left atrium lives right in here in a dog. It's very, very mildly enlarged. And you can see right in here, there's a little bit opacity right in the middle, right in here where this left atrium tends to live right in the middle of the heart. And if you look real close, coming right down in here, we can see there's a little faint black stripe, little gray stripe that you can see here. And that's the trachea coming down. Normally the trachea ventures off a little bit to the right of midline, okay? So the trachea comes down in here, and then the trachea gets to the tracheobronchial region right in here, and then it tends to branch. So here's our trachea coming down, and you have to look real close, but here's another little black stripe that comes down in here. So that's the bronchus that's going down to this lung lobe, the right caudal lung lobe. And there's another one that comes over here, and that's the bronchus going to the left caudal lung lobe. Okay, the left atrium lives right in that area between that bifurcation of the bronchi. Now, I went to school in vet school in Texas, and I learned this as when the left atrium becomes enlarged, this is, you imagine this is a skinny cowboy, the trachea, this is his legs. And when that becomes enlarged, you get what's called a bow-legged cowboy sign because it tends to splay apart these bronchi or the legs of the cowboy. Okay, let's look at that. So again, that's where the left atrium lives. That's where the left atrium lives on the VD view. In a cat, it's a little bit different. In a cat, when they get atrial enlargement, unlike a dog, which it tends to bulge this area right up in here in the 1 o'clock position, with cats, it tends to bulge all of this area right in here. And so they get this prominence over here, basically on the right side of the heart. And because of the atrium becoming enlarged, you tend to get this flattening or almost a concave appearance of the heart back here as this area becomes enlarged. Okay, so cats look a little bit different when they get atrial enlargement than a dog does. Okay, left ventricular enlargement. Okay, where does the left ventricle live? Well, if I look at our dog right in here, the left ventricle tends to live right down in here. And on the VD view, the left ventricle is this pointy apex is where the left ventricle lives. So I think I have that marked here is the left ventricle and right down in there. That's the left ventricle where it lives. Okay, right heart enlargement. If I get enlargement of the right heart, we tend to see wide hearts on the lateral view and decreased distance between the heart and the thoracic wall on the VD view. So where does right heart enlargement, if it becomes enlarged, where does it live? Well, on the VD view, it tends to live right up in this area. And on the lateral view, on the VD view, we get enlargement of the right heart in that area. Okay, extra cardiac signs of heart disease. If you remember from physiology, probably you learned this, that when the left heart tends to fail, you get sequela to that. So what can you see that would tell you a dog is in left heart failure? For the most part, blood then can't get back into the left side of the heart. So you start to get pulmonary veins that are dilated. Okay, so we get enlarged, dilated pulmonary veins. And when the left heart starts to fail, we get what's called pulmonary edema. And pulmonary edema is actually fluid that is forming inside the lung itself, not around the lung, but in the lung. Okay, so signs of left heart failure would be venous congestion and pulmonary edema. Signs of right heart failure, what would that be? Well, right heart failure, you tend to get enlarged pulmonary arteries as opposed to the veins. And you get pericardial fluid, you might get pleural fluid. So now we got fluid around the heart and around the lungs. And it also will cause fluid to back up inside the abdomen because the cauda vena cava can't drain blood back into the right side of the heart because the right heart is sick, it's failing. And so you tend to get a big liver and fluid in the peritoneal space. Okay, so you need to know the signs of left heart failure basically is, do you get pulmonary edema and congestion of the pulmonary veins? And right heart failure, you tend to get a big liver, ascites, you can get pleural effusion, pericardial effusion, and some arterial dilatation. Okay, now we're going to talk about classification of cardiac disease, and this is how we're going to go through this. We're going to go through some of the common congenital heart defects. We're going to talk about what they are, kind of the mechanism behind them, and what you would see radiographically if a dog had one of these diseases. Is there any specific things radiographically that will give you a clue? Yes, they have a congenital heart disease and maybe what type it is. Okay. Then we're going to talk about acquired heart diseases. So acquired heart diseases obviously are things that you're not born with, but you acquire over time with age and with disease pathologies over time. Pericardial disease, we'll spend just a little bit of time on that because they're pretty rare in dogs. So this is there's something wrong in the pericardial space itself. So something that's causing fluid accumulation in the pericardial space, or you have a mass in the pericardial space. And then lastly, we're going to talk about myocardial diseases. So myocardial diseases is there is something wrong of the heart muscle itself. It doesn't contract right, it's weak, it's thin, it's too thick. So we're going to talk about diseases of the heart muscle itself. Okay, let's take about a 10-minute break right there. That's a good place to take a break. And then we're going to come back and talk about specific congenital heart diseases.